Hello friends, welcome to my channel, Nurses Toolkit. My name is Prosper. I'm a registered nurse in the UK and in Ghana. On this channel we educate nurses, prospective nurses and the general public. In today's presentation we are going to look at false representation, which is one of the professional values topics. We have 15 topics in professional values. Out of the 15, you will get one on your exam day. It's a silent station, and so a scenario will be given. You read through the scenario, and then you'll be required to write the actions that you are going to take in such situation. And so this is designed for those who are going to have their NMC UK exam. And so if you are joining me for the first time, or if you are seeing me for the first time, I will entreat you to like, to share, and to subscribe. And so, false representation, you are working with a new RN who has falsified information to get a job he is having. What will you do as a nurse? And so, number one, I will recognize that false impersonation to provide a reference is an unlawful fraudulent action. Number two, I will acknowledge my professional duty to report the unlawful and dishonest behavior of my colleague. And I'll let him know that if I don't do that, I risk my personal fitness to practice. And there's a possibility that my PIN will be taken away from me. And so when I see anything of such, it is my professional duty to report to the appropriate quarters. Number three, I'll recognize that the action of falsely providing a reference could indirectly create a risk to the safety of patients in the care home. And this is because if a nurse could falsify information to get a job, then it is possible such a nurse could also falsify patient observations. And so anything that you see to put your patients at risk, you need to report it as early as possible. The next one, I will make a clear written record of the occurrence, including the date and with whom consent were raised. And so it means everything has to be documented, all that has happened, and I have to make sure I'll be as honest as possible. When I'm raising consent, I'll actually talk about the facts. I will not have to misrepresent it. The next point, I'll recognize that this action will need to be shared with the police and will likely result in the need of a formal police statement. And so this is a criminal offense, and so it needs to be reported to the police as soon as possible. And then the next point, I will ensure that the nurse in question will be removed from the rota, will be suspended. And so if there are any pending shifts in the next coming days, I'll make sure his name is taken out until investigations are done and then the matter is concluded and he or she is now seen to be fit to come to work. Then our last point is the code. And so I'll prioritize people, I'll preserve safety, I'll practice effectively, I'll promote professionalism and trust. And so friends, these are the points. You have to put them in bullet points. It's not supposed to be in a form of essay form. So friends, these are the points. You just have to summarize your actions and it needs to be in bullet points. It need not to be in a form of essay. Let it be as simple as possible. You do not necessarily have to write what is in the marking criteria. Your action should contain the idea and it should be something that will be in line with what is written in the marking criteria. And so for those who are watching me for the first time, please like, share and subscribe to the channel. And meet you again in our next presentation. Thank you for your support.